Hi, this is Marti McCulloch, and we are going to briefly review the cases for the Echo Learning Lab on mitral regurgitation. There are 3 cases. When you open up the software, this is the first screen that you'll see, and under patient name, you'll see the list of cases identified according to which Learning Lab session we're going to be doing. So 5.1, 5.2, and 5.3 are 3 cases with mitral regurgitation. If we want to launch the first case, we're simply going to double click on the patient. This is 5.1. It's going to take you directly to the images. Just some icons on the top to be aware of. You have the work list. That was the list that we just had before. To close out this patient, we would hit close patient. Edit is if you wanted to edit the patient's demographics. Calc is a key button, what you want to know. If you want to do any measurements, you're going to use this icon right here. If you want to edit any of the calc measurements that you've added to the report, you would edit here. Report will actually take you to the report, and images will take you back to the images. Then on the image screen, what you'll notice is there's a cine in the center, right? The main image in the center. If you want to manipulate the image in the center, you'll use these icons on the bottom here. This is play. This is stop. This is if you want to go to the next thumbnail or the next view, or to the previous view. If you wanted to increase this entire image for the whole screen, you could do that as well. This is for contrast and brightness, and this is if you wanted to go frame forward within the cine loop. Okay? So for mitral regurgitation, this is a typical mitral valve prolapse, a Barlow's valve. And this is peristernal long axis. This is the peristernal long axis with color. There we go. Notice the regurgitation, so we can pause. We can frame through. And there you go. So it's a quick jet of MR. If you wanted to measure the vena contracta, you could do it one of 2 ways. You could either go to calcs, and you could go to 2D. You would want to use these icons right here because they'll allow you to do a specific measurement as opposed to a protocol measurement utilizing these icons up here. So you could go to 2D. We would enter in, we could say other label. You could either do mitral valve or other label being MR, and we could measure dimension, right? So for the vena contracta, there you go. And another alternative, what you could do is you could also simply, instead of going into the calc measurement, do a quick calc. And a quick calc, all you do is right click on the image. It'll give you this screen right here, and you can go to quick calcs, go to calc, and go to 2D, and you can do your measurement again. Okay, there you go. And let's see. Okay, so we'll go to the apical views. So these are the apical views looking at the MR. Notice that it's probably not significant. There we go. So probably a late systolic jet. So this is MR in the 4-chamber. This is Doppler in the pulmonary vein. Notice there's systolic flow reversal, sort of late systolic flow reversal. When you look at the CW, again, you'll see that it's more of a late systolic jet. Okay, so that's pretty much it for the first case. Let's go to the second case of MR, and that would be 5.2. We're going to double click, and it will launch the case, skipping over the report and taking you directly to the images. Okay, so here we go. Here's peristernal long. And this is a greater degree of regurgitation. So here we go. Again, if you wanted to make a vena contracta measurement, you could pause, scroll through to the frame that you prefer, and you can either go to calcs, or you can right click, go to quick calcs, and do a 2D measurement right here, the narrowest neck. Hold on, quick calcs, calc, 2D. Here we go. There we go. And let's review this in the apical view. So Here is 4-chamber, looking at the mitral regurgitation. And this is a zoomed up image looking at the PISA with the shifted baseline. Here we go. Good. So notice that the baseline's been shifted. So if we wanted to do a PISA measurement, we could simply, you can pause and you can scroll to where you actually want to start doing your measurements. So this looks pretty good right here. So we're going to go to Calcs, and then we're going to go to Doppler, and we're going to go for mitral valve, and we'll click on PISA. And it's going to ask you to enter the value of the aliasing velocity. Okay, so that would be 46.2. We're going to hit OK. The radius is, you can either enter the radius if it was already on the study, or you can measure it yourself right here. There's the radius. And then notice on the left-hand side right here, it's going to walk you through the measurements that it needs you to do in order to finish the calculation. It says trace the regurgitant TVI, then click the right mouse button. So we're going to go to the actual image with the regurgitant TVI, and we're simply going to trace it. So here we go. So there we go. Right-click when you're done, and then you have all of your measurements listed below here. You have the aliasing velocity, the radius, regurgitant flow, regurgitant TVI, peak regurgitant velocity, effective regurgitant orifice area, as well as the regurgitant volume. And if you agreed with these measurements and you wanted to save them, you would simply either click Next or right mouse click. So there we go. And that's sort of PISA in a nutshell. So the last case that we're going to look at, so we're going to close out this patient. We're going to go close patient. And then we are going to see the last case. The last case is a TEE with mitral regurgitation. So just to give you a different perspective, not sure how much time we're going to have during the learning lab to go through these cases, but put this in there just in case. Once you launch the image, it'll take you directly to the study, and you can click throughout the images. Notice that, again, this is a TEE. The transducers pass through the esophagus. And notice that there's probably 2 jets here, 2 jets of mitral regurgitation, which are illustrated in some still frames here. So we can review that. And this is the TEE. So looking forward to seeing everybody at Echo Florida. See you soon.